Hi, I'm Stambaugh from the laboratory at Lancaster General Hospital. Welcome to our laboratory. We're going to take you on a brief tour today of our new facilities that we're up to 43,000 square foot renovation project that has lasted over 7 years in 5 different phases. We're ready to move the laboratory into our next phase of patient care, and I'll take you on a journey through the lab. We're very proud of the technology and high automation that we've been able to put into the lab through this project. We do over 2 million tests per year, and you can tell from our past we've had a lot of manual methods when we've done testing. Now we've been able to automate in a number of areas. Let's take a tour through the lab. This is our lab specimen receiving department. This is the place where all specimens come to the laboratory. They may come from lab testing areas, from physician offices, and from our inpatient locations. We process a lot of specimens here. We do about 9,000 registrations a month, and on an average weekday we get 7,000 tests and 3,500 specimens.
Hi, I'm Bennett and I work in specimen receiving. Our biggest impact on patient care is how efficiently we can receive and move specimens to the lab. We have multiple registration areas, and we've redesigned around specimen delivery, registration, order entry, and labeling.
So how do specimens get to the lab? It all begins with our phlebotomy team. Here's our phlebotomy lab, which the team works out of. They work through nursing units and actually bring all the specimens to the lab, and they monitor collections and stack collections from this area. From a number of barcode areas, they're actually able to monitor the orders, and we do over 140,000 venipunctures per year.
Hello, I'm Emily from Phlebotomy, in which we have the latest technology of bedside scanners to improve positive patient ID. We have greatly reduced our errors in patient identification with these scanners, as well as improved our speed on the floors. Here in phlebotomy, we all know that quality lab results begin with quality specimens.
One of the next places we'll go is our point-of-care testing area. This area monitors all the bedside testing and competencies of staff that happens throughout the hospital.
Hi, I'm Espey from point-of-care testing. Point-of-care testing is a big part of patient care, and it's very important that things are done accurately and precisely. In this area here is where we set up our machines to make sure that they are accurate for patient testing. We are also responsible for monitoring the compliance and competency of over 200 instruments and 2,600 employees who perform patient care testing.
Here we are in our core laboratory. This is the main part of our laboratory. We've actually been able to add 3 main automation lines here: chemistry, hematology, and urinalysis. One of the things that we've built our lab on is an open lab concept, which means that for future growth and flexibility, we don't need to knock down walls. We have a very open lab that we can just change around modular furniture, modular benches to actually implement or change around instrumentation. So the core lab has become a very flexible part of our laboratory as we continue to do testing from all sorts of physician offices, the lab testings, and our inpatient population.
I'm Darren, one of the techs here in the core lab. One of the newest additions into the laboratory is our chemistry automation line, where we can throughput as many as 300 specimens per hour. Most results are automated, which allows us to move things electronically, which allows us to move things quickly into Epic.
Here's our Beckman full automation line for chemistry. It allows full automation and sample tracking to all the connected instrument analyzers that are on it. Here, specimens are sorted and scanned and processed for centrifugation down the line. As they come off the centrifuge, we'll see how they enter instruments for onboard testing. As you can see here, the centrifuge removes large amounts of specimens from the centrifuge and places them onto the line track. The specimens will be processed and scanned along the way to make sure they're going to the right instrument for analysis. This expedites testing and gets results to the bedside in a quicker fashion. This is our refrigerated Beckman stockyard. It's the last part of our automation line that actually stores thousands of specimens that have been tested and processed. The computer is actually able to find the specimen with ease, place it back on the line, and actually perform testing that may have been added on. This is another one of our automation lines. It's our Sysmex hematology line. Even CBCs and differentials are automated to allow for digital microscopy and cell counting. This allows for standardized testing, less errors, and more accurate test results. This is our new microbiology lab. Here's where we perform over 25,000 blood cultures and over 35,000 urine cultures each and every year. It's become very highly automated as well. We'll take a look at some of the instruments here. Molecular testing has also found its way into the microbiology lab by way of our Cepheid. It's a molecular platform that has now been able to identify the exact strain of bacteria much more quickly in order to reduce length of stay. This testing now gives us results for flu, MRSA, Staph aureus, C. diff, and even GC chlamydia in hours rather than days. That's faster results getting to our patients and providers to allow antibiotic therapy to occur more quickly and appropriately. Here's one of our newest pieces, the inoculant. It's one of the first in the country which we actually went live with at the end of last year. What it's able to do is actually automatically plate specimens onto culture plates and even eventually incubate them. What was once a very manual process is even now becoming automated in the microbiology laboratory. This is our microscan area here in microbiology, where we do a lot of antibiotic susceptibility testing for the bacteria and isolate identifications that we performed. This is how we get the right antibiotic therapy to the patient.
Hi, I'm Mallory Westcott from Microbiology. Here you can see our new state-of-the-art plate reading area. We now have the space to handle more of this testing, which relies on our well-trained techs who use a large amount of biochemical testing to make bacterial identifications. Through new automation and our larger lab facilities, we can now impact turnaround time and patient care more directly.
Here we are in the blood bank, the transfusion service for the hospital. Here's where we handle two different things. One is patient testing for compatibility testing in those patients with imminent transfusions. This is to handle some of the compatibility testing that might also be automated to support surgery, trauma, MTPs, and even areas like oncology. The second thing we do in the blood bank is to handle the manufacturing of collected blood products from our blood donor center. The blood donor center is out at the campus, and this is where all blood products come back to this area for processing and manufacturing. Here's our blood product manufacturing area of the blood bank. This is where all the donated blood products come back to the blood bank, and this is where we perform all the manufacturing that has to occur. We receive about 10,000 units of blood a year from our blood center and from our community blood drives throughout the county. Here we manufacture over 12,000 platelets, fresh frozen plasma, and other plasma products, and even do red cell leukoreduction. Anatomic pathology is another large area of our laboratory. Here we receive over 27,000 surgical specimens throughout our health system, where we process them here. Here, our pathologist assistants perform initial gross analysis. Our new lab has allowed us to redesign more efficient workflows throughout our pathology area. We'll show you that in just a bit.
Hi, my name is Donna Roush. I'm one of the 3 pathologist assistants here at LGH. This is our gross room and our new workstations. We process the surgical specimens received from OR, and as you know, we're working with a lot of hazardous chemicals. These gross stations provide ventilation and keep us safe. We are the first part of the pathological exam that is critical for patient diagnosis.
This is our new histology lab here in pathology. This is where all those tissues are processed so that they are prepared for microscopic analysis. Our new lab has allowed us to process tissue specimens more effectively and with exact patient identification throughout the process using the Vantage barcoding system. All slides, tissues, and final analysis are all linked to a central barcoding system that allows for exact patient identification.
Hi, I'm Mike Davis, lead tech here in histology. We've impacted patient care by implementing state-of-the-art equipment, which enables our pathologists to make accurate diagnosis. In our new lab, we have streamlined our processes and workflows, which has had a positive impact on patient turnaround times.
Lastly, here's our new Cytology Lab. Here's where we do a lot of pap testing and where we analyze the cells for abnormalities and malignancies. One of our major instrumentation systems here is the automated thin-prec imaging system. This does all the automation testing and digital imaging for our paps that are actually sent to our Cytotex microscopes.
Hi, I'm Jen Gallagher, lead cytotechnologist for the Cytology department. Our new lab has brought us great efficiency in screening our PAPs by bringing imaging automation directly from the slide to the microscope. This has reduced our turnaround time from weeks to days.
So you can see from our brief tour we've had a chance to do a lot of new technology, new efficiencies, and bring a lot of staff pride to our laboratory. We're very proud of what we've accomplished, and we'll finish up to show you some of the last things we've done here in the lab. Here from our referred testing lab, that's a brief tour of our new laboratory. You can see the laboratory is a very science-driven and clinically focused area that produces diagnostic information to many different providers. Our dedicated team knows that it's more than just a specimen, it's a patient. We also know that today, diagnostic tests account for over 70% of healthcare decisions. On behalf of all my laboratory colleagues, I want to thank you for taking the time to visit with us. Laboratory is a very exciting place with a lot of new technologies. If you or any of your team would like to visit with us, we invite you to do so. Our house is open at any time. This is your laboratory, and we're very proud of what we've accomplished. Thank you again for visiting the lab.